Patient A, 45 years old, female, is a call center agent who has been working on a night shift over a month. Because of this job, she always experiences the complaints from customers and pressure from her boss. Several days ago, she has kept feeling dizzy, headache, and neck pain after the night shift. A decided to go to the hospital. Upon assessment, her blood pressure is 146 over 106 millimeter of mercury with all other normal laboratory test results. She is diagnosed with primary hypertension. Hypertension or high blood pressure. It is when the pressure of the blood being pumped through your arteries is higher than it should be. Blood pressure, the measurement of blood that is released from the heart in each contraction and the amount of blood flow present in the arteries. When taking the blood pressure, systolic and diastolic pressure is being measured. Systolic pressure is the amount of pressure the heart generates or produces when it contracts and pumps out blood to the body. Diastolic pressure is the amount of pressure happening in the arteries when the heart rests after each contraction. There are two types of hypertension, the primary and secondary hypertension. Primary hypertension is also known as essential hypertension, and it is called the silent killer because it can happen even in a healthy person and there is no known cause causing the increase in blood pressure. The signs and symptoms are headache, dizziness, neck pain, and high blood pressure result. Meanwhile, secondary hypertension, the blood pressure is high caused by secondary causes or diseases like patients with kidney problems, pregnant women, and patients with heart problems. Factors are age. As a person ages, the blood vessel loses flexibility, which contributes to increasing blood pressure throughout the system. The arteries becomes hardened and less active, and the kidneys' function decreases. Obesity. The fatty tissue accumulated in the blood vessel causes the increased vascular resistance, and it will cause an increase in heart's work to pump more blood throughout the body. Diet. Sodium and potassium acts together in maintaining fluid balance in the body. Too much salt intake causes the body to retain fluids and causing arteries in the body to constrict, and not adequate potassium intake will affect the body's response. Stress. It produces an increase in hormone production as the body's way to compensate, and this will cause a temporary increase in blood pressure by causing the heart to beat faster caused by narrowed blood vessel. Hereditary. Genetic factors play some role in increased blood pressure because of the genes passed from one generation to another and also due to common shared environment. The laboratory and diagnostic tests for hypertension include urinalysis, serology or blood test, and electrocardiogram or ECG. Upon learning about A's status and the only abnormal assessment and test result is her high blood pressure, the doctor considers A's high blood pressure is caused by stress and anxiety that she is experiencing. The main parts of the body involved are brain, heart, and blood vessels. The anxiety and stress can be stimuli to her brain, which causes nerve impulse to sympathetic fibers, then result in increased heart rate and contractility and vasoconstriction, both contributing to increased blood pressure. When arterial blood pressure rises, it activates baroreceptors. These stretch receptors are located in the carotid sinuses. Dilations in the internal carotid arteries, which provides a major blood supply to the brain, in the aortic arch, and in the walls of nearly every large artery of the neck and thorax. When stretched, baroreceptors send a rapid stream of impulses to the cardiovascular center, inhibiting the vasomotor and cardioacceleratory centers and stimulating the cardioinhibitory center. The result is a decrease in blood pressure. Primary hypertension cannot be cured, but most cases can be controlled. Restricting salt, fat, and cholesterol intake, increasing exercise and losing weight, stopping smoking, managing stress, and taking antihypertensive drugs can all help. After talking with the doctor, A knows more about primary hypertension now. The doctor tells her to change her lifestyle and gives her medication.